Dr. Chandra, thank you for joining us.
My pleasure.
Let's start from the present, and I'd love to go back right to your story right at the beginning. You're a professor at both Harvard Kennedy and Harvard Business, and as an individual, deeply committed to advocating for health as a human right, and as someone who has that business acumen as well. Could you please share with us your story and perhaps a pivotal moment that shaped your belief in quality healthcare for all?
Sure. Abhinav, what a privilege and an honor to talk to you and get to meet your listeners. I don't know if there was a pivotal moment, but to provide you with some context, I grew up in Delhi. I went to St. Columbus School in Delhi. I graduated from St. Columbus and I came to the United States after I graduated, which was a long time ago. The thing that I remember about growing up in Delhi was that everyone I knew needed healthcare of different types. My grandmother lived with us. She needed healthcare. Um, my relatives needed healthcare. The people who helped us at home needed healthcare. So the demand was clearly a universal demand. But what struck me were two things. One, access was incredibly uneven. So people who had money or people who work for the government could get themselves access to healthcare. And so that was kind of troubling because what if someone was poor? Then how are they going to get access to healthcare? It seemed very unequal. And the other point that stuck with me again and again was that even amongst the people who had access, even amongst the people who had all the money and all the government connections, there was no guarantee that they had access to quality healthcare. No guarantee at all. They were just trying to get in to see a doctor, and a doctor was a doctor was a doctor. But there wasn't the sense that Dr. Abhinav is a much better doctor than Dr. Amitabh. And if there was, it was not through any objective measure of quality. It was like, well, everybody else thinks that he's a great doctor, so I must go to him. But, what if everybody's wrong?
Yeah.
Right? And so I think those were the two big lessons that stayed with me when I left Delhi and when I came to the United States. I didn't know that I wanted to work on healthcare. I didn't know I wanted to work on access. I didn't know that I wanted to work on quality. But certainly I left India with the correct sense that regardless of our socioeconomic circumstance, race, religion, gender, money, we're all going to need healthcare.
Yeah.
Bad things happen to everybody. And second, even if you have the access, there was just no guarantee that your access was the right access. I mean, simply saying I'm going to Ames and not this other hospital doesn't mean you're getting access to high quality healthcare at Ames. I mean, sure, there's a ton of variation within the doctors who work at Ames. But there was this sense in Delhi that, like, if somehow you got to Ames, that was going to be the best care. Maybe, maybe not.
How did your journey come through from, experiencing healthcare and the benefits and the scarcity of it as well as the need of it to from that to Harvard and that to Harvard Kennedy and Harvard Business School?
Yeah, great question, Abhinav. I came to the US. I thought I wanted to be a computer scientist. I landed up realizing that computer science was great, but I was more drawn to solving economic problems. At that time, I didn't know that economics would have something to say about health economics. I didn't know at that time that it would have something to say about access, about inequality, about quality. But I was drawn to the tools of economics because one thing that economists are good at is they're good at making sense of very complicated problems. So most people will say everything is more complicated than you ever thought it was. And the job of the economist is to say, actually, it is very complicated, but at its heart, there's only one or two really important things. So I was drawn to that way of thinking. I got my undergraduate degree, my master's degree, my PhD at the University of Kentucky, where I learned economics. My first job was at Dartmouth, which is a university up in New Hampshire. And that's where I got exposed to problems in US healthcare. And I could see the similarities with what you and I have just discussed. I could see that many of the challenges in US healthcare were challenges that I had seen as a child growing up in Delhi at a much bigger scale. So in some sense, the US has these problems, but these problems, while they seem big to Americans, are actually even bigger in India.
Yeah.
And so that was a great asset, I think, that I had, because I could always see, I always had perspective for what people were working on in the US. I came to Harvard in 2005. I got tenure in 2009, and I've been here since 2005. And really, for me, it was this exposure to healthcare and health economics at Dartmouth. And just to be very clear, that was a focus on US healthcare. And I hadn't started there, but that is certainly where I wound up.
So going back to US healthcare and how you observed all these similarities in the problems of Indian and US healthcare services, we have talks of how we are pricing the priceless. For example, there was a Thiola price hike. We have the opioid crisis as well. Your work is at the intersection of pricing and health economics. And, the UN has this sustainable development goal, which is to cater to the health and well-being of one and all. What is the fundamental disconnect in the healthcare industry that prevents companies from reaching both business success and sustainable healthcare?
It's a great question. I'm going to give you a long answer. At a very high level, I don't think there's that barrier, just to be clear. I think at least in the US setting, if you're a company that figures out how to deliver astonishing value to patients, you will succeed in general. Now, there are exceptions, as you pointed out. So let's start with the exceptions. There are lots of individuals and companies in the US that are not delivering exceptional value to patients, but have figured out how to charge exceptional prices to patients. But that is not the general rule. And I think the solution to that is more regulation of those companies, right? Like ultimately, you're dealing with very vulnerable populations when you're talking about healthcare. You're talking about cancer patients, heart attack patients, pregnant mothers. So this is not an area of economic activity where we want unregulated, laissez-faire markets to work, in part because in the chance those markets don't work, the downside is catastrophic. Let me put it to you differently. Imagine I'm just making baby formula milk, and I get it right day in and day out, 24 hours a day, 365 days a year. But one day, just one day in a century, I mess it up. Thousands of babies will die. Right? So even though the market works, an unregulated market for infant health just doesn't work. And I think heart attack treatments and the delivery of babies are no different. Healthcare is an area where we're going to need companies and businesses, but we're also going to need heavy regulation. It doesn't work kind of without the regulation because, and I don't mean that I mean that just because the downside of failure is colossal in healthcare.
So do you think that it is the absence of core regulation that is preventing companies from reaching this sweet spot of commercial success and sustainable, good healthcare?
I think the lack of regulation, Abhinav, is what explains the really egregious actors in our society. So you mentioned Martin Shkreli. He jacked up the price of Darapren when he shouldn't have. That we could have solved with better regulation. The opioid crisis we could have solved with better regulation. Why did the FDA approve these drugs in the first place? Why was it that none of the insurance companies push back on covering these drugs that are known to be highly addictive? So, there's a variety of kind of problems that happen when you don't have sufficient regulation. There's also a thing called too much regulation. You could regulate this industry to the point that you stifle all kinds of innovation. So I think this regulation of healthcare is definitely a balancing act where you have to balance the benefits of regulation against the cost. For the two examples you gave me, I think we just had insufficient regulation. In general, at least in the US context, I think the marketplace for healthcare works. Could it be better? Sure. But I think in general it works. And when I say it works, I mean the companies that are making a lot of money are also the companies that are delivering a lot of value. I think that's like that seems like a necessary part of the definition of, is this marketplace working?
That's a very interesting take because oftentimes we hear about how the US healthcare system is quote unquote broken. But here you are saying how the companies that are good value creators for customers, for patients, those are actually delivering real value. And if it's at a price, then so be it. But in general, the lack of regulation is what is causing or incentivizing bad actors to come in and do price hikes or not deliver good healthcare.
Correct. And I think, I mean, when people say US healthcare is broken, that's too blunt of a diagnosis.
Yeah.
Right? What is broken about US healthcare? Well, a couple of things are definitely broken. We don't have universal coverage, so not everybody is insured in the United States. That's a problem. That problem is solved not by markets. Markets don't know how to solve that problem.
Yeah.
That problem is going to be solved by government saying, let's subsidize care for the poor and the sick, right? Like, suppose we thought that everybody had a right to a car. Just suppose, just example, just as is a bad example, but let's run with it for a second. Everybody has a right to a car. That problem is not going to be solved by Toyota, by Ford, by Suzuki, right? They're not, or by Honda. They're not going to solve that problem. If we think that everybody has a right to a car, then the only person who's going to solve that problem is society, is government.
Yeah.
So if we think healthcare is a right, that problem is not going to be solved by the hospitals, by the pharma companies. That's going to have to be solved by some payer coming in and ensuring that the right is actually delivered. Right. And so I think there's a problem with access in the United States, just like there's a huge problem with access in India. And I think just like in India, quality of care is incredibly heterogeneous, incredibly uneven.
Yeah.
But those two problems are quite different than saying it's broken. I think people like who say it's broken don't really understand that's not a solution to anything, because there's specific things that need to be improved. It's not like the whole thing is broken.
Yeah. So talking about the economic benefits of good health, Japan has a better healthcare system than that of China. And in your research, you have talked about how good access to healthcare leads to improved worker outcomes and improved productivity. Could you share how that is really the case, and how can countries like the US, which is developed, or India, which is developing, how can they really improve their access to healthcare to have a good, positive economic outcome?
So let me say a couple of things. First, Japan and China are very different. I mean, it is true that healthcare in Japan is much better, more generous, higher quality than healthcare in China, but also like per capita income in China is about $20,000 a year, right? And per capita income in Japan is about $45,000 a year. So more than 2x difference. So when you've got 2x differences in income, it's kind of unsurprising that you'll get better healthcare in the country that's richer. Because like so much of healthcare is expensive. So the more money you have, the more of that expensive technology you can buy, right? You can buy the expensive cancer drugs. You can buy the expensive imaging machines, the richer you are as a person and also as a country. To your second question about worker productivity, I have two thoughts I want to share. The first is, it is actually not my belief that better healthcare necessarily leads to higher worker productivity. It absolutely can. But most of healthcare is consumed by little kids or by really old people. That's where most of the spending is. You're going to spend a bunch of care in your first 6 to 9 months of life, that first hospital admission when you're born, all the initial treatment that you need when you're born, all the vaccines, all the pediatrician visits. And then, you start to get older, like in your 80s and 90s, you're going to need a ton of healthcare. Yeah. So right there, it's another way of saying more healthcare, better healthcare is probably not affecting worker productivity. If we get a great drug for Alzheimer's, I do not think that it increases worker productivity because it's going to benefit people in their 80s. It's a good thing to invent, which brings me to my next point. The reason you want great healthcare is not necessarily to increase worker productivity. I think we want great healthcare because it allows people to have wonderful, fulfilling lives.
Yeah.
Not necessarily because they can experience higher worker productivity. So, the healthcare allows me to live to my 90s and watch my children grow up. That's wonderful, even though I might not be able to work more. But just the experience of life with good health is so important that that's the primary reason we want good healthcare. The productivity angle, I think, is a very to put it bluntly, it's a very Marxist frame on it.
Yeah.
Because it can result, I think, in some very unethical allocations. I think it could end up being an allocation where we invest huge amounts of money to provide healthcare to people aged 20 to 60. And basically, when you turn 65, 70, we're like, you know what? You're never going to be productive. We're just going to let you go, which I think is a fundamentally dangerous and unethical place to be.
Yeah.
But coming back to what drives worker productivity, that's such an important question. What drives worker productivity, I think, is probably not healthcare. Is probably things like excellent prenatal care. Like, is your mom healthy? Is she taking nutrition? Birth spacing. Like if my sibling is born quickly after me, then maybe I'm not getting mother's milk or nutrition as much as if there had been more birth spacing. That could be a reason. The environmental quality affects things like my lung function, asthma, my ability to walk and run, which affects my productivity. So there's a variety of things that affect worker productivity, which I think of as being the public health environment, which is closely related to healthcare, but is actually separate than healthcare.
Lovely. I really enjoyed listening to that part of the answer. We've talked a lot about business policy. We've talked a lot about healthcare policy. What I'm also curious about is how those two converge in your mind. You have this unique experience of being at Harvard Kennedy and Harvard Business. And I'd love to understand how having these dual experiences have shaped you and your thinking. Could you share with us how Harvard is unique in the sense of imparting that kind of thinking? And how have you started to think about global problems, micro problems, or even the day-to-day activities from this unique blend of these two experiences?
For me, I think you were really prescient in your ability to zero in on this with the first question you asked me. Look, I think for great healthcare in any country, we're going to need business and we're going to need government. I don't think it's just government, nor do I think it's just business. Government is incredibly slow. Like, left to its own devices, government is not going to give us a great drug for Alzheimer's, the next generation of cancer therapies. Government is not going to develop a better a CT scanner. Government really doesn't know how to exploit AI to do faster diagnosis. It just doesn't know how to do any of those things. Business knows how to do all of those things. However, business doesn't know how to regulate itself. It has to be regulated by the government. The businesses will also bring all kinds of dangerous drugs to market. All kinds of snake oils will be sold to people in an unregulated fashion. And business doesn't do a good job of making sure that its products are accessible to the poor and the sick. Like, if you look at any successful company, take Apple, which is one of the world's most successful company. If Apple's products cannot be used by poor children in India, that's not a dilemma that keeps Apple shareholders awake at night. But if you're a pharmaceutical company and you have a drug that could help poor people and you're not able to access those poor people because there isn't a payer, that means that those people are going to die of not getting access to your therapy, which is a problem, because why did you then invent that therapy in the first place? Yeah. So I think without business and government in healthcare, you don't really have a high quality system. That's the reason I think, and I enjoy having the Kennedy School of Government title and affiliation in Harvard Business School. You asked me a question about Harvard's role in all of this. I mean, Harvard it's a remarkable institution. It probably has the largest bench of health economists, health policy experts in the world. It's an institution that realizes that an industry like healthcare is incredibly complicated. And to solve complicated problems, you need expertise. You don't need just people to say it's complicated. You need people who can actually cut through the complications and propose concrete solutions. So I'm extremely grateful to be part of the Harvard ecosystem.
Let's go a bit more specific and pointed and particular on that part. I'd love to understand how your own thinking, mental models, and decisions have been shaped through this blend of experiences. How do you think about a problem today versus how were you thinking about it 15 years before, right? How has your thinking evolved?
I think what has evolved more than anything else is that none of us, no single discipline, has a particular monopoly on how to solve a healthcare problem. I don't think healthcare is going to be solved by just smart doctors, brilliant nurses. I don't think it's going to be solved by really intelligent IAS officers or Supreme Court justices or politicians.
Yeah.
It's a sufficiently complicated problem that we need expertise, but we need a lot of different experts sitting at the table.
Yeah.
You need people who know the budget, who know finance, people who know the healthcare, people who know the public health, because some things are much better done by public health than by healthcare.
Yeah.
If you're trying to improve the environment, if you're trying to improve air pollution in Delhi, there's no hospital in Delhi that can do that. That's going to be a public health measure. You need government, you need regulators sitting at the table because they understand the shenanigans that businesses will play if you don't regulate them sufficiently.
Yeah.
You need lawyers because at the end of the day, a lot of healthcare requires business-to-business transactions, which are governed by the law and the contracts between government and businesses. So I think the thing that I've learned is humility that, as an economist, I might have a lot to say, but also that there are incredibly valuable perspectives that other people involved in healthcare have. And they all need a seat at the table.
Yeah. Yeah.
A healthcare system designed only by economists will not be very good.
Yeah.
A healthcare system designed only by doctors would not be very good.
Yeah.
A healthcare system designed only by government would not be very good. And a healthcare system designed only by business would do right by business, but would not necessarily solve all of society's needs.
Going on to that, how you need many actors to solve the healthcare problem. You need lawyers, governments, businesses, regulators, people who understand the intricacies, medical people, and so on and so forth. There is this concept of the revolving door, wherein a person from a government position goes into a private company. And oftentimes we see this clash of incentives from somebody who is regulating a company, then goes ahead and works in that company after their government tenure expires. What do you think about incentives and that part's misalignment in the healthcare industry? And what can we learn? What can we do as individuals to remedy that?
I think there's two ways to think about the revolving door. One is to think about all the problem cases. And the other way is to think about all the benefits of the revolving door. So there's lots of private companies in healthcare, lots of hospitals, insurance companies who would benefit from having people who are former regulators serve on their boards or lead them, literally be the CEO of those companies. That could be incredibly valuable to the company. Similarly, it could be, and we have a long tradition of this in the US government, valuable to have people from business serve in government, because government left to its own devices might not understand what business is capable of. And so it's using regulations that were necessary in the 50s, but are not necessary in 2023. And it might take someone from industry to do that. So on net, I feel like the revolving door is not a problem on net. I think you could point to hundreds of examples where it has been a problem. And my hope is that greater transparency in what those prior connections were could provide some improvement. So in other words, disclosing to the public, disclosing to the media and the journalists that Amitabh Chandra is now working as a government officer, but before that, he was working at this private company. That doesn't mean that he's always biased, but you need to know that,
Yeah.
because that might reflect some bias or a conflict of interest. I think that transparency is good,
Yeah.
Especially in an environment and in a country like India, which has probably one of the most active presses, free press, which is good.
Yeah. That's a very interesting take as well. Zooming out from healthcare a bit, we've talked about health economics, health policy, company incentives, and how we need a combination of actors to solve the healthcare problem. Let's zoom out from healthcare for a moment and also dive into how you think and how you make decisions and what are your values and systems. What can the 30-year-old aspiring entrepreneur or that visionary college graduate or that 40-year-old plus individual who's wanting to make a difference in whatsoever field they are in learn from you about what matters in the world and what they should be working on?
God, I don't know if they learn anything from me, actually. I would hope these people are all in my classroom, so I hope to learn a lot from them because they are the entrepreneurs. I mean, that's the key word. They're the ones who will bring new products, new technologies, new inventions to patients. So I would bet on them. Now, you might ask, what sort of the general advice I might give an entrepreneur? I think my advice would be fairly boring, but it would be a couple of things. The first would be to learn to speak succinctly. Don't speak a lot. You have seconds to speak.
Yeah.
So if you are able to speak in short, simple sentences without jargon, that goes a very long way. And I think the use of jargon, like including things like I'm going to use machine learning or something like that, that's jargon. The other person may not know what you mean, or they don't like machine learning. So they're actually not impressed at all.
Yeah.
So I think speaking in English without the use of jargon is powerful. Speaking succinctly is very powerful. Listening is unbelievably powerful. I think that one thing that often holds very talented people behind is that they are not able to listen. They have this need to talk because they're excited, but then they're not taking much from the meeting. They come off as knowing all the answers and they might not.
Yeah.
I think the last thing I would say is if you're a young aspiring person, not just an entrepreneur, and you ask for time from someone who is quite influential in your field, maybe they're a venture capitalist, maybe they could invest in you, maybe they're a politician, maybe they're an IS officer, you should know that that person is very busy, super, super busy. They have a lot of things to do other than talk to you. So use your time wisely. Maybe just don't meet with them at all. Like, in other words, simply because you've met with someone might not mean that you did anything productive for you because you took them away from their job. They might be super polite about it, but you took them away from their job. So it's not always clear to me that young entrepreneurs remember this. They land up asking for a lot of meetings with influential people. The influential people are often slightly annoyed, and it doesn't help the entrepreneur.
Why do you think it
Ultimately,
doesn't
you
help?
want the meeting. You want the meeting if it can help you. So in other words, there's a time to meet someone.
Yeah.
And when you're super early in your invention journey or in your company dreaming or in your career, if you're a college student, it is not a great use of your time to meet a famous venture capitalist. You're just distracted that famous venture capitalist. Now, if you are running a company, you need a Series A investment. This is a good time for you to talk to a venture capitalist.
Yeah. That's very
There
counterintuitive.
is a right time for every meeting is kind of my big macro advice. And simply because you could email someone and get someone's time actually might not just be a waste of your time. Worse than that, that person will never meet you again.
Yeah. That is very counterintuitive. Sam Altman on his blog, he has this 13 rules for success, and one of the things he talks about is that it's very fashionable to seek and take advice.
Yeah.
And one of his success mantras was that he ignored all the advice. And what you're saying is sort of a practical instantiation of that advice, because you don't really need to meet and get all those insights, especially at the wrong time. In fact, it could be counterproductive if you do it at the wrong time.
100%. And I mean, that's a great way of thinking about it. I can make this personal. As a kid growing up in Delhi in the 1980s, that's when I was in school, I was given a lot of advice. I'm glad that I never listened to it. And I'm glad that my parents never listened to it. Most of that advice was wrong. If I had followed any part of it, even the slightest part of it, I would not be talking to you today. The advice was good for other people. It wasn't good for me. So the advice was you should go to the IITs.
Yeah.
I didn't want to be an engineer. I still don't want to be an engineer. I love engineers, but I don't want to be an engineer.
Yeah.
And so the advice I was given was correct advice for many kids. It was bad advice for me. It was just bad advice for me. So I think another version of saying this is like simply talking to a lot of people and getting advice is not automatically productive. It can actually be extraordinarily destructive. Life is like running a marathon. Like ultimately, these people who are giving you advice are not running the marathon along with you. So ultimately, you have to have some fire inside you that allows you to complete the marathon. That doesn't come from having a bunch of advisors at the starting point. That comes from having a bunch of cheerleaders who will run with you the entire course of the marathon. Yeah. And those aren't the people that you're going to meet once at a party or once over a Zoom, right? They are not the people who are going to be your cheerleaders on the marathon.
Yeah. Yeah. I love this particular section because it reveals a lot of insight that you normally would not come across, from reading a few self-help or entrepreneurial posts. So that is very counterintuitive and straight from the heart, which I appreciate. Let's switch gears and go back to our healthcare conversation for a bit as well. One of the things that I think our viewers and listeners would benefit a lot from is sort of a tour of different healthcare systems around the world. From the start of this conversation, we dive right into the problems, the policies, and actors in resolving problems of particularly US healthcare industry and the incentives of that. I'd love to understand why the US healthcare system is the way it is. What are its problems? Why the UK healthcare system is so effective and cheap? And what do you think about India's healthcare system? So if we were to do a tripartite analysis of these three from a 30,000 feet overview level, I think that would be very informative for us to develop more knowledge about it.
I think so. India, first of all, doesn't have a healthcare system. So I think of it as having kind of piecemeal healthcare that you buy based on how much money you have at the time that you need the care, which is not a system.
Yeah.
A system would think about prevention and all of that. And it wouldn't have access be tied to income. So in what works in India is if you have a lot of money, you need a stent, you need a bypass, you need a knee replacement, hip replacement, you can get that. You can go to a great hospital, pay a lot of money and get that. But that again is sort of like paying out of pocket as you need healthcare, which is not a system. You're buying healthcare just like you would buy an Apple computer or a car, not a system.
Yeah.
So in terms of countries that have systems, you've got a country like the UK where the government provides healthcare to everybody through a system where doctors and nurses are owned by the government. And so what happens as a result is everyone in the UK has universal access to a pretty basic system. Yeah. The NHS hospitals have wards. You could have other patients in your room. The care is good, but it's not going to cover a variety of very expensive things because it's a public system. So if your child has a very rare disease, maybe your child has spinal muscular atrophy and they need a gene therapy that's been approved, you might not get that therapy in the UK. If you have a particular cancer, not even a rare cancer, a very common cancer, you might not get Keytruda or Optivo or one of the great immunotherapies that are now available in the US for your cancer because this basic system run by the government doesn't have money to cover.
Yeah.
So, but on the other hand, if you needed a hip replacement, knee replacement, you had a heart attack, you had a stroke, you were in a car accident, regardless of your ability to pay, you would get all of those services in the UK. You would. Now, in the US, what's interesting is if you are very poor, or if you are a child, or if you are over the age of 65, you probably have access to the latest, greatest medical treatments through a combination of government programs and philanthropic provision by hospitals and doctors. So if you needed that rare gene therapy in the United States and you were very, very poor, you would actually be covered by a lot of government programs for that super expensive therapy. If you were in private insurance like me and you had a heart attack or a stroke, it would work really well for you. What doesn't work in the US are two things. We do a lousy job of prevention. So no one's trying to prevent my heart attack. Once I have the heart attack, I get A+ service, but maybe there was a better, cheaper alternative to me having the heart attack. No one's trying to prevent my diabetes. But if I have diabetes, I would have access to the full suite of latest diabetes drugs. I would have access to all the new weight loss drugs that everyone's heard about, but they might have been a cheaper solution, which is like maybe that I shouldn't have gotten obese in the first place. US is very bad about thinking about those things. Second, what the US is very bad at doing is half of America gets its health insurance through its employer. So I work through Harvard University. My insurance comes through Harvard University. That sounds great until you realize if I got really, really sick, I wouldn't be employed by Harvard University. And if I got a little sick, Harvard would employ me. But if I got terribly sick, like I just couldn't do my job, Harvard would not keep me employed, in which case I would also lose my health insurance. But that's when I need it most.
Yeah.
So I think the US's reliance on insurance from employers fundamentally is a bad way of insuring people. If people lose their jobs because of a pandemic, suppose we had some unknown virus that swept through the world, that's just science fiction, but you never know. Yeah. And a bunch of people lost their job, well, they'll also be losing their health insurance in the US, which is kind of a crazy system.
Wow. I think that's a brilliant overview of India not having a healthcare system per se,
yeah.
UK having very good healthcare for standardized things, but not enough advanced healthcare because it's government sponsored for unique or rare things. And the US not focusing on preventive medicine, as well as the inherent flaw of how employers provide healthcare insurance to their employees. I think that's a wonderful articulation. Going off of that, what do you think about alternative medicine and anti-aging treatments, particularly coming from those based out of the US? And in the context of that, I'd also love to talk about precision medicine and what you think about the future of both anti-aging treatments, the Andrew Hubermans or David Sinclairs or Brian Johnsons and so on and so forth of the world, as well as how that aligns with having a precision healthcare treatment delivered to patients and customers alike.
Yeah, that's a really important question. I think let me break it apart. First, I do not believe in alternative medicine of any type, be it Indian Ayurveda or other traditions. I think most of it is just unadulterated rubbish.
Yeah.
And people are harming themselves and their children by trafficking in it. I am open to any Ayurvedic homeopathic therapy that can show robustly an effect on patients. So the reason I don't like alternative medicine is not that it's alternative, it's that it hasn't gone through the rigorous review that allopathic medicine has gone through. And most of people's fears with allopathic medicine are people who know very little about science. So, people get worried about allopathic medicine, but if you actually kind of query them on their medical knowledge or their knowledge of biology, tends to be small. I think they should be much more worried about the alternative medicines that they're using. I think we have no idea what heavy metals are going into the production of homeopathic treatments that little kids are getting, which damages their livers for their entire life.
Right.
So if you're a parent watching this, just know, in my opinion, alternative medicine is actually not just unproven. I think it's potentially deadly.
Okay.
Anti-aging is different. I think my view is any medicine that can go through rigorous human trials and demonstrate a positive effect on human beings should be embraced. So if we find ways to slow aging, reverse aging, slow dementia, reverse dementia, and we're able to concretely demonstrate that, not something like I drank turmeric milk. My grandfather drank turmeric milk and he never had Alzheimer's, which is the kind of nonsense you hear all the time. That is alternative medicine. That has no basis. But if you could show in a clinical study that people who drank turmeric milk forever, didn't have dementia, then I think it stops being alternative. Then it becomes medicine.
Yeah.
So in that sense, I'm optimistic about any therapeutic modality that is evidence-based, where people are willing to do systematic clinical trials and show the value of their medicine. I'm less sure that we'll be able to reverse aging. I do believe that in our lifetime, we will not only be able to slow certain aspects of aging like Alzheimer's, I think there will be insights from biology, particularly development biology and regenerative medicine, that allow us to cure entire diseases. Curing a disease is different than anti-aging, but it's a bit like anti-aging in the sense that, in theory, let me give you an example. If you think that type 1 diabetes, which is sometimes called juvenile diabetes, if you think that type 1 diabetes is caused by the immune system attacking the beta cells in the pancreas, in theory, you could use regenerative medicine to get the stem cells in my bone marrow to regenerate as beta cells in the pancreas that then cure my disease. Like I don't have type 1 diabetes, right? That kind of regenerative medicine is adjacent to anti-aging. It's not anti-aging, but it's like anti-aging in that you have cured an entire disease, not using a medicine, using your body.
Yeah.
That I think is incredibly promising. But it will only be as good as our ability to evaluate these therapies robustly, scientifically, ethically, using the best science, and none of the storytelling. We can't do the storytelling. In other words, we need clinical trials. We can't be like, well, he went there and got that treatment and then his thing was cured. That's like I went to this Swamiji and he touched me and then my deep diabetes disappeared. That I think is very dangerous.
Yeah. I think your insights are particularly relevant for our viewers and listeners. And as we close, I want to ask this one last different non-healthcare, but very specific and personal question about how you operate as an individual. What would you tell the 20-year-old Amitabh Chandra today? And how have you thought about your life's journey over the past decades in terms of your evolution, both professional and personal?
I think, and I mean this candidly, the most dangerous force in India is advice from the 50-year-old uncle. That 50-year-old uncle is the person you should never listen to. So I am not going to give the 20-year-old version of myself any advice because all the 50-year-olds I met had exactly the wrong advice to me, which makes me think I probably am no different than them. And so I'm probably advising the 20-year-old version of myself incorrectly. I think you, by the age of 20 or 21, certainly I was only 18 when I left India. You have enough knowledge, self-knowledge about yourself that you have to fall on that self-knowledge to propel you forward and not the advice of the 50-year-old uncle at the Diwali party or at the birth. That is probably the most dangerous person out there. That person claims to know vastly more than they actually know. So trust yourself, trust your conviction, trust your friends who may also be 18 or 19-year-old. Individually, all of you might be wrong. Individually, all of you might be wrong, but by talking to lots of people like you, I think you have a much better sense of what's happening. And most importantly, you know what excites you, and I don't. I only know what excites me. So when I give you advice, I tell you about what excites me, but what excites me doesn't excite you. That's another reason you should not listen to the advice of elders. You really should not. So, in terms of like what has actually, the second part of your question, worked for me, I think what has worked for me is this peer group of unbelievable friends and colleagues that I have had for 30 years from the day I landed in the United States, who I've grown with and who I go to for advice. And I have made mistakes and they have given me mistaken advice, but on balance, I am just filled with incredible gratitude for all the experiences I've had. And so I think that that's a good place to be, to be filled with gratitude when one is 50 years old. And I think one way you can be filled with gratitude is knowing that you made the decisions. You were in the driver's seat of your life's journey, not the 50-year-old uncle that you met at the Diwali party.
Wow. That is so lovely. Dr. Chandra, this has been such a pleasurable and insightful experience talking to you about everything related to healthcare, but also everything surrounding it and how you think about not only healthcare related problems, but also micro and global problems.
What a pleasure, Abhinav. This was just, it was so much fun. And good luck to all of your listeners. I wish you the best and happy Diwali.
Thank you so much.